Hello students, this video will be helpful for you to learn something about vaginal speculum. So it is an instrument used mostly in gynecological department, obstetrics and gynecology. This video we are going to learn about introduction of the speculum, definition, history and advancements in the vaginal speculums, types of speculum, uses of speculum, considerations, preparation of the patient before pelvic examination, how to perform a speculum examination and the special circumstances of speculum exam. Introduction. Speculum is a duck bill shaped device that doctor used to see inside a hollow part of the body and diagnose or treat the disease. One common use of speculum is for vaginal speculum. Gynecologists used it to open the walls of the vagina and examine the vagina and cervix. So normally a speculum is used to see inside the hollow part of a body, okay, which is like any kind of hollow part, like your nasal canal or your anal canal. Okay, so in this video we are going to examine the complete vaginal canal. Okay, so that's why it is called as vaginal speculum. Definition. A speculum is a device used to look inside the vagina. So this is the definition of a vaginal speculum. It is used to look inside the vagina and observe the cervix. A speculum examination is often performed alongside a bimanual examination as a part of complete gynecological workup. It means bimanual means you have to as it's shown in the picture. Okay, so it both hands are used. Okay, one hand on the abdomen. Okay, abdominal examination as well as vaginal examination is done to do a complete gynecological workup. A vaginal speculum typically consists of two hinged blades that can be adjusted to open and close. The instrument can vary in size and shape to accommodate different anatomical needs. These blades are usually made of stainless steel or plastic. History and advancements. History. The speculum has a long history, with early invention dating back to ancient Greeks and Roman times. But in modern versions, it has evolved significantly to improve comfort, ease of use, and effectiveness in examinations. The advancements which are made in the vaginal speculums are: the first is improved designs. Contemporary specula are designed with ergonomic handles, better materials, and more adjustable parts. Disposable options are available. The availability of high quality disposable specula reduces the risk of cross infection. And integrated lighting. Some specula come with a built-in light sources to improve the visibility during exams. So these are the advancements which are made in these vaginal speculums. Now we'll see about the types of vaginal speculum. For we have about many times for 5 types, and we'll say one by one. First is bivalve speculum, that is called cusco speculum. Two-bladed or bivalve speculum is the most common type of instrument the gynecologist use to examine the vagina and the cervix. The doctor inserts the speculum into the vagina and opens up the blade, which exposes the inside of the vagina and cervix. Vaginal speculum come in different sizes. Which one of the following speculum types your doctor chooses depends on the age and the length and width of the vagina. So according to the age and the length and the width of the vagina, the doctors will choose the type of speculum they are going to use. The types are the first will be the second type is the pediatric speculum. So gynecologists used in the shorter version of the speculum to examine the vagina in infants and children. Next is the Huffman speculum. This is long, thin speculum. It's narrower than a regular speculum. It is used in a teenaged girl who haven't been yet sexually active. Next is the Peterson speculum. So this is used in a teenage girls who never been sexually active. Its blades are narrower than those of a regular adult speculum, but larger than the blades of a Huffman speculum. Next is a grave speculum. It has the widest blades of any speculum. Gynecologists use it for the adult woman, and it comes in larger size for those with especially a long vagina. So these are the types of vaginal speculum. Now we'll see about the uses of speculum. Speculum is used during a pelvic exam to check the vagina, cervix and other reproductive organs for problems. The speculum opens up the vaginal canal to make the organs easier to see. The speculum is also used for procedures like biopsy, colposcopy, dilatation and curettage, endometrial ablation, in vitro fertilization, intrauterine device placement, loop electrosurgical excision procedure, vaginal hysterectomy, intrauterine insemination, and in vitro fertilization. So, these are some of the procedures where these speculums are used. So, consideration. So, what all things you have to consider before doing a speculum examination is first will be comfort. The procedure will be uncomfortable for the patient, but communication and use of proper technique can minimize the discomfort. Next is infection control. We have to keep in mind the sterilization is very essential, crucial for reusable of the specula to prevent infections. The sterilization, the whatever instrument you are putting inside any canal of for the patient, you make sure that is sterilized, okay, or it should be a disposable one, okay. Next is patient anxiety. Some patient may feel anxious about the exam, so a calm, professional demeanor and a clear explanation can help alleviate the concerns. So that's about the consideration. Next is preparation of the patient. How will you prepare the patient for a speculum examination? The patient ought to have an empty bladder, as this can make the examination less comfortable. Ask the patient to remove all clothing from the waist down and any sanitary protection, and cover with sheet when appropriate. Prepare your equipments, gloves, lubricant, speculum, any which kind of speculum. It can be a Cusco speculum or a Huffman speculum, whichever, according to the age of the patient and the length and width of the vagina. Okay, so you have to choose the speculum, and if at all you are going to collect any smear and swabs, any kind of biopsy, okay, so all that should be prepared well in advance. So as you see in the picture, so the in vagina, so the center one, okay, that hollow is the vagina through which the speculum is inserted. That speculum is called the Cusco speculum. It is a duck beak, okay, speculum. So it is inserted into the vagina, and above that we see is a bladder, and below that is a rectum. So all these organs will be affected during this speculum examination. So you make sure the patient has an empty bladder and she has passed the urine before the procedure. So this is the patient side preparation you should do. So next is the actual procedure, how to perform the speculum examination. So first will be abdominal examination. As we said earlier, for a complete gynecological workup, you have to do a bimanual examination, which includes the abdomen examination also. So in abdomen examination, you have to inspect the abdomen for scars and ascites, palpate the abdomen for masses and tenderness, palpate the groin for inguinal lymphadenopathy. All these things you should be ruled out. Next is the external examination. So before touching the patient, before inserting an instrument, okay, just look at the introitus or the perineum, okay, and do the examination. What all you will notice is the patient should be laid back on their back with the legs bent at the hip, feet towards their buttocks, and asked to flop their knees apart. Put a pair of gloves, inspect the external genitalia for deficiency associated with childbirth, abnormal secondary sexual characteristics, if there are any hair distribution, clitoromegaly, and skin abnormalities like lesions, warts, erythema, discharges. If there is any discharge, you have to note the color and consistency, and if there is any bleeding, and if there is any swellings in the vulva like tumor or cyst or any Bartholian glands or sebaceous glands, okay, swelling, and ask the patient to cough or strain to observe any incontinence or prolapse during the observation, and palpate the labia majora with the index finger and thumb for any kind of spellings. So these are the external examinations you have to do before touching the patient. Next is the actual speculum examination. lubricate the speculum and warn the patient. Okay, just tell the patient I'm going to insert, and part the labia. Okay, separate the labia using your left hand. Gently insert the speculum with your right hand. Fully insert as it is shown in the picture. Fully insert the speculum with the screw facing sideways and the blades vertical, and rotate 90 degrees during insertion, so the screw faces upwards and the blades become horizontal. Okay, so the insert the speculum with the screw facing sidewards and the blades vertical means that is given in the step 2. Okay, the screws are facing sideways and the blades are in the vertical direction in the picture number 2. So if you see in the picture tree, the screws are in the sideways and the blades are in the horizontal. Okay, so that's the picture 3. And in 4 we see that the slowly open the blades and use the light to inspect the cervix, tighten the screw to hold up the speculum, so you can use your right hand for swabs or pupil biopsy if necessary. Okay, any kind of biopsy, cervical biopsy you can do. So that is given in the picture number 4. So after opening, okay, what you will look for? Okay, first you have to look for any abnormal discharge, erosions, ulcerations, growth, inflammations, bleeding, polyps, and ectropion. So as it is given here, so picture A shows a normal cervix and B shows cervical ectropion. Okay, at this point, if at all going to do any kind of investigations like swabs or biopsy, that should be taken if required. Then to remove the speculum, and first undo the screwing. Okay, you close the blades and then you have to remove the speculum. That's very important. Remove the speculum, undo the screw to allow the blades to close, leave open slightly not to pinch the vaginal walls, and rotating back 90 degrees and gently remove. So these are the procedures to remove the speculum examination. To complete the examination, what you will do is thank the patient, allow them to get dressed in private, dispose the gloves and wash your hands. Once the patient is dressed, you can summarize the findings and suggestions, give your further suggestions for investigations, and send the specimens with a request form. So in special circumstances, there are some special circumstances where you need to do some investigations. You need to take any biopsy or smear. Okay, so those will come under special circumstances that we'll see. The first is the assessment of descent. Okay, uterine descent. Okay, that will see during that will be done with a sim speculum. Sim speculum can be used to assess the prolapse of the uterus. Ask the patient to lie on her left side and bring her knees to her chest. Insert the blade of the speculum along the posterior wall of the vagina to hold it back. Ask the woman to cough while looking for uterine descent and cystocele. Repeat while holding back the anterior wall looking for rectocele and enterocele. Okay, so it's basically make the patient lie down on her side. Okay, lateral side. Then you insert the sim speculum blade of the sim speculum, okay, along the posterior wall and ask her to cough. Again insert along the anterior wall and ask her to cough and look for the uterine descent as it is shown in the picture. Where will be, if the bladder is descent, that is called cystocele, and if the rectum is descent, that is called rectocele, and if there is cystocele, enterocele. Okay, uterine descent, because of that the uterus is also descended, then it is called uterine descent. And the last picture it shows precedentia. Precedentia means complete prolapse of the uterus. The uterus and the bladder and the rectum, everything is come out of the out. Okay, so it means the complete introitus. Okay, there is no introitus and complete uterus is outside of the perineum. Okay, that's called precedentia. So next special circumstances is the obtaining swabs. Swabs often required in cases of suspected infection. Pick up the sample tube with the right hand and place it in the left hand, and with the speculum secured with the screw, and remove the lid if a separate one is present, and sometime use the chaperone, using the chaperone is useful. Take out the swab with the right hand and perform swabs in this order. And high vaginal charcoal media swabs circle around. So if you want to take a high vaginal swab, you have to circle around the high vaginal wall once. Okay, that is done to detect any candida and group B streptococcus and other organisms. So as it is shown in the picture, you have to with the speculum inserted inside, you have to insert the swabs and take the the specimens. If you are doing an endocervical swab, you have to place the endocervical canal and do a 360-degree sweep in case of if suspected gonorrhea. Next is endocervical chlamydia swab. Scrub the endocervical region for 10 to 30 seconds and then place the used swab back into the tube in your left hand and close the lid and label the specimen. This is how you will take the swab. Next is smear. Okay, basically a pap smear. How will you do a pap smear? A cervical smear is used to detect the precancerous changes in the cervix. Pass the cyto brush. Okay, in case for a smear, you will need a brush or a spatula. Okay, through the vagina, which is held open by the speculum into the endocervical canal. Turn the brush 360-degree 5 times. Introduce the brush to the specimen pot and move the brush against the bottom of the pot to dislodge the cells into the liquid. Label the specimen and send it off to the liquid based cytology. Okay, so this is how we will do a endocervical smear. These are the special circumstances. So I hope you gained some knowledge regarding this vaginal speculum. We saw what is vaginal speculum, the definition, okay, the types of the vaginal speculum, uses of vaginal speculum, and we saw the considerations. What are you have to consider? Okay, the patient's privacy important, comfort is important, the sterilization is important. Okay, psychological support is important, and how do you prepare a patient and how do you actually perform along with the abdominal examination, external examination and speculum examination. And then we also saw some of the special circumstances, okay, where we can assess the procedentia, that is uterine descent, and doing a cervical smear and obtaining a cervical swabs. So I hope you gain some knowledge regarding vaginal speculum. We'll see in the next video. Thank you all.